Good morning, friends. I am Dr. Mandar Doiphode. I am a gastroenterologist and GI endoscopist practicing at Gastro Hub Hospital in Pimpri Saudhagar. So, in this video, I'll be talking about GERD or gastroesophageal reflux disease. It will be a series of videos. In this first video, I'll be talking about the definition of GERD and various anatomical factors which are responsible for a person to develop this GERD. So let's first understand what is GERD or what is gastroesophageal reflux disease. So it is a condition in which the contents from the stomach will regurgitate or will go back into the food pipe or into the esophagus, and that will lead to variety of symptoms in a patient. So one important question is, why should one understand or why should one learn about this GERD? So the simple answer is this GERD is really very prevalent in today's day and age. Almost 30% of the individuals will suffer with symptoms of GERD at least once in their lifetime. Not only that, this condition can lead to variety of complications. Some complications could be really major, which includes even cancer of the food pipe. And that's why understanding the various causes and various symptoms of disease is really important, so as to prevent a person from developing these symptoms and also to prevent further complications of this disease. Now, to explain the various anatomical factors which are responsible for GERD, I am taking help of this anatomical diagram. As you can see here, this is our food pipe, this is our stomach, and this is the small intestine. Now, normally between the food pipe and the stomach, there is a sphincter, or it is a door which will allow the food to go only in one direction from the esophagus into the stomach. Now, in a normal individual, after the food reaches the stomach, this sphincter should close down, and that will prevent the contents from the stomach from going back into the food pipe. Normally, when the food reaches the stomach will secrete acid, and that acid will get mixed with the food. And after the acid is mixed into the food, slowly the stomach will start churning, and that churning is called peristaltic activity. The purpose is to break down larger food particles into the stomach, mix them with the acid, and slowly push the food ahead into the small intestine. Now, when this peristaltic activity starts, the stomach will act like a closed balloon, and the pressure will be exerted in all the direction. But normally, if this sphincter is closed, so even if the pressure is exerted in this direction, the food will not come back into the food pipe. But in the individuals in whom this sphincter is little lax, then some part of the food will slip back into the food pipe. And now, as this food is mixed with the acid, so along with that food, some acid will come back, or acid will regurgitate into the food pipe. Normally, the stomach has two types of cells. So one type of cell will secrete the acid, and another cells will secrete a kind of mucus. That mucus forms a protective covering over the stomach mucosa, so that the harmful effects of the acid will not trouble the stomach. But similar mucus secreting cells are not there into the food pipe, and so when the food acid regurgitates into the food pipe, there is nothing that will protect the esophageal mucosa from the harmful effects of the acid, and in that situation, that person will start developing GERD or reflux symptoms. And that's why understanding the various causes and effects of GERD are very important. So thank you, friends. In the next video, I'll be talking about various clinical features or various symptoms of GERD and various complications of GERD. Thank you.